Accuplacer Next Generation Reading Exam Practice Test.
Question 1. While preparing Malik for a basic metabolic panel, at the urgent care unit, Malik is awake and the requisition lists a basic metabolic panel. Which action best confirms the patient identity before the draw? Option A. Ask a coworker if the patient looks familiar. Option B. Ask the patient to state two identifiers and compare them with the requisition and labels. Option C. Use the room number because it matches the schedule. Option D. Collect the specimen first and verify the chart afterward. The correct answer is option B. Ask the patient to state two identifiers and compare them with the requisition and labels. Positive identification requires active confirmation with two patient-specific identifiers and comparison with the order and labels. Room numbers can change, visual recognition is unreliable, and verifying after collection increases the risk of a wrong patient specimen. Question 2. During an oncology clinic collection, during a routine collection in Bay 7, the wristband and requisition do not match. What should the phlebotomist do first? Option A. Use the patient statement only and ignore the wristband. Option B. Draw the specimen and write a note on the tube. Option C. Stop the collection and resolve the discrepancy according to facility procedure. Option D. Ask another patient nearby to confirm the identity. The correct answer is option C. Stop the collection and resolve the discrepancy according to facility procedure. Identification discrepancies must be corrected before any specimen is collected. Drawing first, relying on one source, or asking another patient creates an avoidable patient safety and specimen integrity risk. Question 3. After reviewing the therapeutic drug level order, a requisition for Victor is missing the provider name and test priority. Which response is most appropriate? Option A. Choose routine priority because most draws are routine. Option B. Ask the patient which tests are needed. Option C. Collect all possible tubes to save time. Option D. Clarify the incomplete requisition before collecting the specimen. The correct answer is option D. Clarify the incomplete requisition before collecting the specimen. A complete order supports proper collection, timing, tube selection, and result routing. Collecting extra tubes, guessing priority, or asking the patient to select tests can lead to incorrect or unauthorized testing. Question 4. During Ari's afternoon draw, a blood culture is ordered stat for a patient in the urgent care unit. What does the stat priority mean? Option A. The specimen should be collected and processed immediately. Option B. The patient must be fasting for the test. Option C. The specimen can wait until the next routine round. Option D. The draw should be cancelled if the patient is not in bed. The correct answer is option A. The specimen should be collected and processed immediately. STAT indicates urgent collection and handling because clinical decisions may depend on rapid results. It does not mean routine timing, fasting status, or automatic cancellation based on location. Question 5. At exam room 5 during an afternoon round, Zara says they ate breakfast before a fasting CBC. What is the best next step? Option A. Tell the patient to deny eating so the specimen can be collected. Option B. Follow facility policy by documenting the information and confirming whether collection should proceed. Option C. Cancel the order without notifying the appropriate staff. Option D. Collect the specimen and label it as fasting. The correct answer is option B. Follow facility policy by documenting the information and confirming whether collection should proceed. Fasting status can affect results, so the information must be handled according to policy and communicated when required. Falsifying fasting status, ignoring the issue, or canceling without proper notification is unsafe and unprofessional. Question 6. Before a basic metabolic panel collection, a patient scheduled for a trough drug level is due for the next dose soon. When is the trough specimen usually collected? Option A. only after the medication has been stopped for 24 hours. Option B. At any convenient time during the day. Option C. Immediately before the next scheduled dose. Option D. Immediately after the medication is swallowed. The correct answer is option C. Immediately before the next scheduled dose. A trough level measures the lowest drug concentration and is usually collected just before the next dose. Drawing after a dose, at a random time, or after stopping therapy can misrepresent the medication level. Question 7. In the long-term care facility, a peak drug level is ordered after medication administration. Which action supports accurate timing? Option A. Skip documentation because peak levels are routine. Option B. Collected before the medication is given. Option C. Collected whenever the tourniquet is already applied. Option D. Use the ordered collection time and facility protocol for that medication. The correct answer is option D. Use the ordered collection time and facility protocol for that medication. Peak timing depends on the medication and must follow the order and facility protocol. Drawing before the dose, collecting randomly, or failing to document timing can make the result clinically misleading. Question 8. For an adult patient in room 214, which tube should be drawn first when collecting several venous specimens including blood cultures? Option A. Blood culture bottles or sterile blood culture tube. Option B. Green heparin tube. Option C. Gray fluoride tube. Option D. Lavender EDTA tube. The correct answer is option A. Blood culture bottles or sterile blood culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. EDTA, fluoride, and heparin tubes contain additives and are collected later in the venous order of draw. Question 9. While preparing PREA for a hemoglobin and hematocrit, a venipuncture requires blood cultures, a light blue coagulation tube, a serum tube, a green tube, a lavender tube, and a gray tube. Which order is correct? Option A. Lavender, green, gray, serum, light blue, blood culture. Option B. Blood culture, light blue, serum, green, lavender, gray. Option C. Light blue, lavender, green, gray, serum, blood culture. Option D. Serum, gray, lavender, blood culture, green, light blue. The correct answer is option B. Blood culture, light blue, serum, green, lavender, gray. The venous order of draw reduces additive carryover, cultures first, citrate, serum, heparin, EDTA, then glycolytic inhibitor. The other sequences place additive tubes too early or delay sterile blood cultures, which can compromise results. Question 10. During an emergency department collection, why is the order of draw important during venipuncture? Option A. It eliminates the need to identify the patient. Option B. It prevents every possible hemolyzed specimen. Option C. It helps prevent cross-contamination from tube additives. Option D. It makes all tubes fill at the same speed. The correct answer is option C. It helps prevent cross-contamination from tube additives. Order of draw is used to reduce carryover of additives that can alter laboratory results. It does not control fill speed, replace patient identification, or prevent all causes of hemolysis. Question 11. After reviewing the urine drug screen order, a light blue top tube for urine drug screen is underfilled. Why is this a problem? Option A. The glucose level will be falsely preserved. Option B. The tube will become sterile after centrifugation. Option C. The specimen will automatically convert to serum. Option D. The blood to anticoagulant ratio will be incorrect for coagulation testing. The correct answer is option D. The blood to anticoagulant ratio will be incorrect for coagulation testing. Sodium citrate tubes require a proper fill volume to maintain the correct blood-to-additive ratio for coagulation tests. Centrifugation does not fix the ratio, serum is not produced from an anticoagulated tube, and glucose preservation is associated with gray tubes. Question 12. During Kai's preoperative draw, which additive is commonly found in a light blue top coagulation tube? Option A, sodium citrate. Option B, sodium fluoride and potassium oxalate. Option C, EDTA. Option D, lithium heparin.
The correct answer is option B. A valid inference must be based on clues provided in the statement.
Sodium citrate is used for many coagulation studies because it binds calcium in a controlled, reversible way. EDTA is used mainly for hematology, heparin is used for many plasma chemistry tests, and fluoride oxalate is used for glucose-related testing. Question 13. At collection station 4 during an evening round, which tube is typically selected for a CBC? Option A, gray fluoride oxalate tube. Option B, lavender top EDTA tube. Option C, red serum tube only. Option D, light blue sodium citrate tube. The correct answer is option B. Lavender top EDTA tube. EDTA preserves cellular components and is the usual anticoagulant for complete blood count testing. Citrate is used for coagulation, gray tubes help preserve glucose, and a red serum tube does not preserve cells for CBC analysis. Question 14. Before a fasting glucose collection, a chemistry test requires plasma and rapid processing. Which tube is commonly appropriate? Option A, light blue sodium citrate tube. Option B, sterile blood culture bottle only. Option C, green top heparin tube. Option D, lavender top EDTA tube. The correct answer is option C. Green top heparin tube. Heparin tubes are commonly used when plasma is needed for many chemistry tests. EDTA can interfere with chemistry analytes, citrate is intended for coagulation, and blood culture bottles are for microbiology. Question 15. In the outpatient clinic, which tube additive helps preserve glucose by slowing glycolysis? Option A, EDTA only. Option B, clot activator gel only. Option C, sodium citrate only. Option D, sodium fluoride with potassium oxalate. The correct answer is option D. Sodium fluoride with potassium oxalate. Gray top tubes commonly contain sodium fluoride to inhibit glycolysis and potassium oxalate as an anticoagulant. Citrate supports coagulation testing, EDTA supports hematology, and clot activator tubes are used to obtain serum. Question 16. For an infant patient in room 8, a gold top SST is collected for a chemistry panel. What is the main purpose of the gel separator? Option A. It forms a barrier between serum and cells after centrifugation. Option B. It prevents the need for patient identification. Option C. It sterilizes the specimen during transport. Option D. It converts plasma into whole blood. The correct answer is option A. It forms a barrier between serum and cells after centrifugation. The separator gel helps keep serum separated from cells after centrifugation, supporting specimen stability. It does not replace identification, create whole blood, or sterilize a specimen. Question 17. While preparing Maya for a type and screen, after filling a lavender top tube, what should the phlebotomist do? Option A, centrifuge the whole blood immediately for a CBC. Option B, gently invert the tube according to manufacturer instructions. Option C, place the tube upright without mixing. Option D, shake the tube vigorously for 10 seconds. The correct answer is option B. Gently invert the tube according to manufacturer instructions. Gentle inversion mixes blood with EDTA and helps prevent clot formation. Vigorous shaking can hemolyze cells, no mixing can allow clotting, and CBC specimens are not centrifuged before hematology analysis. Question 18. After reviewing the lactate level order, a lavender tube contains visible clots before CBC testing. What is the likely result? Option A. The clot improves platelet accuracy. Option B. The tube color no longer matters. Option C. The specimen may be rejected because cell counts can be inaccurate. Option D. The specimen becomes ideal for coagulation testing. The correct answer is option C. The specimen may be rejected because cell counts can be inaccurate. Clots trap cells and can make hematology results inaccurate, so recollection may be required. Clotting does not improve platelet counts, does not make the specimen suitable for coagulation, and does not remove tube requirements. Question 19. After reviewing the lactate level order, which venipuncture site is usually preferred for routine adult blood collection? Option A, basilic vein as the first choice. Option B, vein on the side with a dialysis fistula. Option C, artery in the wrist. Option D, median cubital vein. The correct answer is option D. Median cubital vein. The median cubital vein is commonly preferred because it is often well anchored and less close to major nerves and arteries. The basilic vein requires more caution, arteries are not used for routine venipuncture by phlebotomists, and fistula arms should be avoided. Question 20. During Daniel's stat draw, why is the basilic vein generally used with more caution than the median cubital vein? Option A. It lies closer to nerves and the brachial artery. Option B. It always contains arterial blood. Option C. It contains EDTA from previous draws. Option D. It cannot be palpated through the skin. The correct answer is option A. It lies closer to nerves and the brachial artery. The basilic vein is near structures that increase the risk of nerve or arterial injury if technique is poor. It is still a vein, it may be palpable, and tube additives do not remain in veins from earlier collections. Question 21. At bed 18 during a weekend round, a patient has a dialysis fistula in the left arm. Which choice is safest for routine venipuncture? Option A, use the fistula arm because it has larger vessels. Option B, use another acceptable site and follow facility policy. Option C, draw directly from the fistula to obtain faster flow. Option D, place the tourniquet tightly over the fistula. The correct answer is option B. Use another acceptable site and follow facility policy. A fistula arm is generally avoided because damage can threaten dialysis access and patient safety. Drawing from it, applying tourniquet pressure over it, or choosing it for convenience is inappropriate without specific authorization. Question 22. Before a blood culture collection, the only visible vein is above an active 4 line. What should the phlebotomist do first? Option A, draw directly above the 4 without documentation. Option B, ignore the 4 because tube additives prevent contamination. Option C, look for an acceptable site on the opposite arm or follow facility policy for 4 situations. Option D, collect from the 4 tubing into all tubes. The correct answer is option C. Look for an acceptable site on the opposite arm or follow facility policy for 4 situations. Specimens should be collected away from active 4 infusions when possible because fluid contamination can alter results. Drawing above the 4, collecting from tubing without authorization, or relying on additives does not protect specimen integrity. Question 23. In the pediatric clinic, a large bruise is present over the intended venipuncture site. Which action is best? Option A, draw through the bruise because blood flow is easier. Option B, massage the bruise firmly before inserting the needle. Option C, apply the tourniquet for several minutes to clear the bruise. Option D, select a different acceptable site. The correct answer is option D. Select a different acceptable site. Bruised or hematoma areas should be avoided because the specimen may be contaminated with tissue fluid and the patient may be injured further. Drawing through it, massaging it, or prolonged tourniquet use can worsen the problem. Question 24. For an infant patient in Suite 12, a patient has edema at the proposed puncture site. Why should that site usually be avoided? Option A, tissue fluid can contaminate the specimen and make collection unreliable. Option B, edema always makes veins arterial. Option C, edema sterilizes the skin surface. Option D, edema guarantees a faster tube fill. The correct answer is option A. Tissue fluid can contaminate the specimen and make collection unreliable. Edematous tissue contains excess fluid that can dilute or contaminate the specimen and makes vein assessment harder. It does not change veins into arteries, sterilize skin, or guarantee good blood flow. Question 25. While preparing Jordan for a lactate level, what is the usual angle for needle insertion during routine antecubital venipuncture? Option A, parallel to the skin with the bevel down. Option B, about 15 to 30 degrees with the bevel up. Option C, any angle if the tourniquet is tight enough. Option D, about 90 degrees with the bevel down. The correct answer is option B, about 15 to 30 degrees with the bevel up. A 15 to 30 degree angle with the bevel up supports safe entry into the vein. A steep angle, bevel down insertion, or relying on tourniquet tightness increases the risk of pain, missed veins, or injury. Question 26. During a blood donor center collection, how should the vein be anchored before inserting the needle? Option A, press directly over the clean puncture site. Option B, ask the patient to pump the fist repeatedly. Option C, pull the skin taut below the puncture site. Option D, hold the needle cap against the vein. The correct answer is option C. Pull the skin taut below the puncture site. Anchoring below the site stabilizes the vein and helps prevent rolling. Touching the clean site can contaminate it, using the cap is unsafe, and repeated fist pumping can contribute to hemoconcentration. Question 27. After reviewing the blood culture order, after cleaning a venipuncture site with alcohol, when should the needle be inserted? Option A, immediately while the site is still wet. Option B, after wiping the site dry with a used gauze pad. Option C, only after blowing on the site to speed drying. Option D, after the alcohol has air dried completely. The correct answer is option D. After the alcohol has air dried completely. Allowing alcohol to air dry supports antisepsis and reduces stinging or hemolysis risk. Inserting through wet alcohol, wiping with used gauze, or blowing on the site can compromise technique. Question 28. During Ethan's evening draw, a phlebotomist palpates the vein again after antisepsis with an unclean finger. What should happen before puncture? Option A, the site should be cleaned again according to procedure. Option B, the patient should wipe the site with clothing. Option C, the tourniquet should be tightened to remove contamination. Option D, the draw should continue because palpation improves flow. The correct answer is option A. The site should be cleaned again according to procedure. Retouching the prepared site can contaminate it, so the site must be recleaned unless sterile technique permits otherwise. Continuing, using clothing, or tightening a tourniquet does not restore aseptic preparation. Question 29. At bed 18 during a midday round, for most routine venipunctures, how long should the tourniquet remain on? Option A, until all tubes have been labeled at the desk. Option B, no longer than about 1 minute when possible. Option C, as long as the patient can tolerate discomfort. Option D, at least 5 minutes for accurate chemistry results. The correct answer is option B, no longer than about 1 minute when possible. Prolonged tourniquet application can cause hemoconcentration and alter some results. Leaving it on for several minutes, delaying removal until desk labeling, or using discomfort as the limit is not appropriate. Question 30. Before a CBC collection, why should patients avoid repeated fist pumping during venipuncture? Option A. It sterilizes the puncture site. Option B. It prevents all veins from becoming visible. Option C. It can contribute to hemoconcentration and affect some analytes. Option D. It replaces the need for tube inversion. The correct answer is option C. It can contribute to hemoconcentration and affect some analytes. Repeated fist pumping can alter specimen composition, including some chemistry values. It does not sterilize the site, replace mixing, or reliably improve every collection. Question 31. In the emergency department, a patient reports sharp, electric pain radiating down the arm during needle insertion. What should the phlebotomist do? Option A. Rotate the needle several times to redirect it. Option B. Ask the patient to ignore it until all tubes are filled. Option C. Advance the needle deeper to finish faster. Option D. Stop the draw and remove the needle safely. The correct answer is option D. Stop the draw and remove the needle safely. Radiating electric pain can indicate nerve contact, so the draw should be stopped to prevent injury. Advancing, ignoring the pain, or rotating the needle can worsen tissue or nerve damage. Question 32. For an anxious adult patient in Bay 3, a swelling begins to form around the puncture site while the tube is filling. What is the best response? Option A. Release the tourniquet, stop the draw, remove the needle, and apply pressure. Option B. Apply heat and keep drawing through the swelling. Option C. Continue collecting because swelling means the vein is full. Option D. Ask the patient to bend the elbow tightly over the needle. The correct answer is option A. Release the tourniquet, stop the draw, remove the needle, and apply pressure. Swelling suggests a hematoma or infiltration, so the draw should be discontinued and pressure applied. Continuing, applying heat during the draw, or bending the elbow can increase bleeding and bruising. Question 33. While preparing amina for a hemoglobin and hematocrit, a patient becomes pale and sweaty during collection. Which immediate action is safest? Option A. Finish all tubes before responding. Option B. Remove the tourniquet and needle, protect the patient from injury, and get help as needed. Option C. Tell the patient to stand and walk it off. Option D. Give the patient food without checking policy or status. The correct answer is option B. Remove the tourniquet and needle, protect the patient from injury, and get help as needed. Pale skin and sweating can signal syncope, so patient safety and stopping the procedure come first. Standing, finishing the draw, or giving food without assessment can create additional risk. Question 34. During an emergency department collection, bright red blood pulses rapidly into the collection device during an attempted venipuncture. What should the phlebotomist suspect? Option A. Normal venous flow from a small vein. Option B. A clotted EDTA specimen. Option C. Possible arterial puncture. Option D. Improper tube inversion only. The correct answer is option C. Possible arterial puncture. Pulsing bright red blood suggests arterial involvement and requires immediate response according to policy. Small vein venous flow is usually darker and non-pulsatile, while clotted EDTA and tube inversion issues occur after collection. Question 35. After reviewing the urine drug screen order, if an accidental arterial puncture is suspected, what should the phlebotomist do? Option A. Apply a loose bandage only and send the patient home. Option B. Collect additional tubes quickly before the artery collapses. Option C. Ignore it if the patient says there is no pain. Option D. Stop the draw, remove the needle, apply firm pressure, and notify appropriate personnel. The correct answer is option D. Stop the draw, remove the needle, apply firm pressure, and notify appropriate personnel. Suspected arterial puncture requires stopping the procedure and applying firm pressure to reduce bleeding risk. Continuing, using only a loose bandage, or ignoring the event can lead to serious complications. Question 36. During Chloe's stat draw, a patient has petechiae after tourniquet application. What do petechiae suggest? Option A. Small capillaries may be fragile or bleeding under the skin. Option B. The needle gauge is too large in every case. Option C. The site is fully sterilized. Option D. The patient has no risk of bruising. The correct answer is option A. Small capillaries may be fragile or bleeding under the skin. Petechiae are small pinpoint hemorrhages that can suggest capillary fragility or increased bleeding tendency. They do not indicate sterility, absence of bruising risk, or automatically prove the needle gauge is wrong. Question 37. At Bay 3 during a preoperative round, which step should occur before removing the needle from the vein? Option A. Ask the patient to bend the elbow tightly. Option B. Release the tourniquet and remove the last tube. Option C. Label the specimen at a separate workstation first. Option D. Activate the needle safety device while the needle is still in the vein if not designed for that. The correct answer is option B. Release the tourniquet and remove the last tube. The tourniquet is released and the tube removed before needle withdrawal to reduce bleeding and pressure. Bending the elbow, misusing safety devices, or delaying bedside labeling can create patient care or specimen identification problems. Question 38. Before a hemoglobin and hematocrit collection, after needle removal, what is the best way to help prevent bruising? Option A. Leave immediately without checking the site. Option B. Tell the patient to rub the site vigorously. Option C. Apply direct pressure with clean gauze until bleeding stops. Option D. Have the patient bend the arm tightly upward. The correct answer is option C. Apply direct pressure with clean gauze until bleeding stops. Direct pressure helps stop bleeding and reduces hematoma formation. Rubbing, bending the arm tightly, or failing to check the site can worsen bruising or miss continued bleeding. Question 39. In the blood donor center, a patient reports an allergy to adhesive bandages. Which response is best? Option A. Apply the standard bandage because allergies are rare. Option B. Use tape directly over wet blood. Option C. Skip pressure and send the patient away. Option D. Use an appropriate alternative dressing according to policy. The correct answer is option D. Use an appropriate alternative dressing according to policy. Patient allergies should guide selection of bandaging materials while still maintaining hemostasis. Ignoring the allergy, skipping pressure, or taping over active bleeding is unsafe. Question 40. For an anxious adult patient in collection station 4, which device is often helpful for a patient with small, fragile veins? Option A. Winged infusion set with an appropriate small gauge needle. Option B. Large bore needle chosen only for speed. Option C. Used needle with the cap replaced. Option D. Broken evacuated tube holder. The correct answer is option A. Winged infusion set with an appropriate small gauge needle. A winged collection set can offer better control for small or fragile veins when used correctly. Large needles may damage fragile veins, defective equipment must not be used, and used needles should never be reused or recapped. Question 41. While preparing Lucas for a type and screen, why might a syringe be selected instead of a standard evacuated tube system for a fragile vein? Option A. It removes the need for a transfer device. Option B. It may allow gentler control of suction during collection. Option C. It makes patient identification unnecessary. Option D. It eliminates the order of draw. The correct answer is option B. It may allow gentler control of suction during collection. A syringe can allow the collector to control suction more gently in selected difficult draws. It does not remove order of draw requirements, should be transferred with a safety transfer device, and never replaces patient identification. Question 42. During a pediatric clinic collection, when transferring blood from a syringe to evacuated tubes, which method is safest? Option A, remove tube stoppers and pour blood into each tube. Option B, push blood through the needle into the tube stopper. Option C, use an approved blood transfer device. Option D, use the same needle to transfer blood after recapping it. The correct answer is option C. Use an approved blood transfer device. A transfer device reduces Sharp's risk and helps preserve specimen quality. Pushing through a needle, removing stoppers, or recapping increases exposure risk and can cause hemolysis or contamination. Question 43. After reviewing the patient NINR order, which action most increases the risk of hemolysis? Option A. Using the correct needle angle. Option B, allowing alcohol to air dry. Option C, gently inverting additive tubes as directed. Option D, shaking tubes vigorously after collection. The correct answer is option D. Shaking tubes vigorously after collection. Vigorous shaking can rupture red blood cells and produce hemolysis. Gentle inversion, air drying antiseptic, and proper insertion technique support specimen quality rather than damaging cells. Question 44. During Ari's fasting draw, a serum potassium result is unexpectedly high, and the specimen is visibly hemolyzed. How can hemolysis affect potassium? Option A. It can falsely increase potassium by releasing intracellular potassium from red cells. Option B. It always lowers potassium to zero. Option C. It proves the patient has no electrolyte problem. Option D. It changes potassium into glucose. The correct answer is option A. It can falsely increase potassium by releasing intracellular potassium from red cells. Red cells contain potassium, so hemolysis can falsely elevate measured potassium. It does not always lower potassium, rule out disease, or transform potassium into another analyte. Question 45. At collection station 4 during an evening round, which practice helps prevent pre-analytical errors? Option A, use only room numbers on specimens. Option B, label specimens at the patient's side immediately after collection. Option C, pre-label several tubes before locating patients. Option D, carry unlabeled tubes to the desk and label later. The correct answer is option B. Label specimens at the patient's side immediately after collection. Bedside labeling connects the specimen to the correct patient at the time of collection. Pre-labeling, delayed labeling, and room number only identification increase wrong patient and mislabeling risk. Question 46. Before a bilirubin test collection, which information is typically required on a properly labeled blood specimen? Option A. Only the test abbreviation without patient identity. Option B. Only the room number and bed color. Option C, patient identifiers plus collection date, time, and collector identification as required by policy. Option D. Only the phlebotomist first name. The correct answer is option C. Patient identifiers plus collection date, time, and collector identification as required by policy. Labels must support positive specimen identification and traceability through collection details. Room numbers, collector name alone, or test abbreviations without patient identifiers are insufficient. Question 47. In the oncology clinic, a phlebotomist realizes a tube was labeled with the wrong patient name after leaving the room. What is the safest action? Option A, send it to the lab because the tube color is correct. Option B, scratch out the name and write another one. Option C, use correction fluid on the label. Option D, follow policy for specimen rejection and recollection if needed. The correct answer is option D. Follow policy for specimen rejection and recollection if needed. Mislabeling is a serious patient safety issue and must be handled by policy, often requiring recollection. Altering labels or sending a known mislabeled specimen can lead to harmful treatment decisions. Question 48. For a teenage patient in Draw Chair 2, which example is a pre-analytical error? Option A, collecting a coagulation specimen in an underfilled light blue tube. Option B, provider interpreting a completed report. Option C, analyzer software calculating a final result. Option D, billing department mailing a statement. The correct answer is option A. Collecting a coagulation specimen in an underfilled light blue tube. Pre-analytical errors occur before testing, including collection, labeling, handling, and transport problems. Analyzer calculations are analytical, provider interpretation is post-analytical, and billing is not part of specimen collection quality. Question 49. While preparing amina for a basic metabolic panel, a specimen for bilirubin testing must be protected from light. Which handling step is appropriate? Option A, place the specimen in direct sunlight. Option B, wrap or cover the specimen as required by laboratory protocol. Option C, transfer it into a gray top tube after collection. Option D, shake the specimen to remove light exposure. The correct answer is option B. Wrap or cover the specimen as required by laboratory protocol. Light-sensitive specimens should be protected using the method specified by the laboratory. Sunlight, shaking, or transferring to an incorrect tube can compromise specimen integrity. Question 50. During an emergency department collection, a specimen must be chilled and delivered rapidly to the laboratory. What should guide the phlebotomist? Option A. The color of the tourniquet. Option B. Whether the patient asks for faster service. Option C. The test-specific handling instructions in the collection manual. Option D, personal preference for all tubes. The correct answer is option C. The test-specific handling instructions in the collection manual. Temperature and timing requirements are test-specific and should follow the laboratory collection manual. Patient preference and unrelated equipment color do not determine specimen handling requirements. Question 51. After reviewing the therapeutic drug level order, why should tubes be inspected before use? Option A. To remove the need for order of draw. Option B. To decide whether patient identification can be skipped. Option C. To make expired tubes acceptable. Option D. To check for cracks, contamination, expiration, or vacuum problems. The correct answer is option D. To check for cracks, contamination, expiration, or vacuum problems. Equipment inspection helps prevent collection failure and specimen quality problems. It does not replace identification, revive expired supplies, or eliminate the order of draw. Question 52. During Hannah's midday draw, a tube has passed its expiration date. What should the phlebotomist do? Option A. Do not use the tube and obtain an acceptable replacement. Option B. Use it if the stopper color looks normal. Option C. Use it only for pediatric patients. Option D. Fill it halfway to compensate for expiration. The correct answer is option A. Do not use the tube and obtain an acceptable replacement. Expired tubes may have reduced vacuum or compromised additives, so they should not be used. Appearance, patient age, or partial filling does not make an expired tube acceptable. Question 53. At room 214 during a routine round, before a capillary puncture, why is the site often warmed? Option A. To make the lancet reusable. Option B. To increase blood flow to the puncture area. Option C. To replace the need for patient identification. Option D. To sterilize the site without antiseptic. The correct answer is option B. To increase blood flow to the puncture area. Warming can improve capillary blood flow and reduce excessive squeezing. It does not sterilize the site, replace identity checks, or permit reuse of single-use devices. Question 54. Before a hemoglobin and hematocrit collection, for an infant heel puncture, which area is generally safest? Option A, center of the heel over the calcaneus. Option B, arch of the foot. Option C, medial or lateral plantar surface of the heel. Option D, posterior curvature of the heel. The correct answer is option C. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel reduces the risk of bone injury when performed correctly. The posterior curvature, center heel, and arch increase the chance of injury or poor specimen collection. Question 55. For an adult patient in bed 18, why should the first drop of blood from a routine capillary puncture usually be wiped away? Option A. It is required for blood culture bottles. Option B. It always contains only plasma. Option C. It prevents all needle stick injuries. Option D. It may contain tissue fluid or debris that can affect the specimen. The correct answer is option D. It may contain tissue fluid or debris that can affect the specimen. The first drop can be contaminated with tissue fluid or skin debris, so wiping it away supports specimen quality. It is not pure plasma, is not used for blood culture bottles, and does not address sharp safety by itself. Question 56. For an anxious adult patient in Bay 3, which capillary collection order is commonly used when blood gases are not collected? Option A, EDTA specimens first, then other additive specimens, then serum specimens. Option B. Any order because capillary tubes have no additives. Option C, gray first for every patient, then culture bottles. Option D, serum first, then EDTA, then other additives. The correct answer is option A. EDTA specimens first, then other additive specimens, then serum specimens. Capillary order differs from venous order and commonly places EDTA early to reduce clotting in small volume samples. Serum first collection, universal gray first collection, or ignoring additives can compromise results. Question 57. While preparing Lucas for a type and screen, during a finger stick, why should the finger not be squeezed forcefully? Option A. It makes the specimen sterile. Option B, excessive squeezing can dilute the specimen with tissue fluid and cause hemolysis. Option C. It removes the need to wipe the first drop. Option D. It changes venous blood into arterial blood. The correct answer is option B. Excessive squeezing can dilute the specimen with tissue fluid and cause hemolysis. Milking or squeezing too hard can damage cells and introduce tissue fluid, affecting test accuracy. It does not sterilize blood, transform blood type, or replace correct capillary technique. Question 58. After reviewing the ammonia level order, which finger is generally avoided for adult capillary puncture? Option A. The ring finger. Option B. A warm finger with good circulation. Option C. The thumb or index finger. Option D. The middle finger. The correct answer is option C. The thumb or index finger. The thumb and index finger are often avoided because they may be more calloused, sensitive, or frequently used. The middle and ring fingers are commonly preferred when suitable, and warming may improve flow. Question 59. After reviewing the bilirubin test order, a used lancet remains on the tray after a dermal puncture. What should be done? Option A, place it in regular trash if the cap is on. Option B, save it for the next patient if it looks clean. Option C, hand it to the patient to throw away later. Option D, discard it immediately into an approved sharps container. The correct answer is option D. Discard it immediately into an approved sharps container. Used sharps must be disposed of promptly in an approved sharps container. Regular trash, reuse, or asking the patient to handle the device creates exposure risk. Question 60. During Kai's routine draw, which statement best describes standard precautions? Option A. They apply to the care of every patient regardless of known infection status. Option B. They are optional for routine outpatient draws. Option C. They apply only to patients with confirmed HIV. Option D. They replace the need for hand hygiene. The correct answer is option A. They apply to the care of every patient regardless of known infection status. Standard precautions treat blood and certain body fluids as potentially infectious for all patients. Limiting them to known infections, treating them as optional, or skipping hand hygiene defeats their purpose. Question 61. At Bay 7 during a preoperative round, when should hand hygiene be performed during routine phlebotomy? Option A. Only after collecting blood cultures. Option B. Before patient contact and after glove removal as part of standard practice. Option C. Only when gloves visibly tear. Option D. Only at the start of the workday. The correct answer is option B. Before patient contact and after glove removal as part of standard practice. Hand hygiene before patient contact and after glove removal reduces transmission risk. Waiting for visible tears, limiting hygiene to the start of the day, or applying it only to blood cultures is inadequate. Question 62. Before a basic metabolic panel collection, which personal protective equipment is routinely worn for venipuncture when blood exposure is anticipated? Option A. No PPE if the patient looks healthy. Option B, reusable cloth gloves from home. Option C, gloves. Option D, sterile surgical gown for every draw.
The correct answer is option B, skeptical.
Gloves are routine PPE for blood collection because contact with blood is reasonably anticipated. A sterile gown is not required for every routine draw, healthy appearance does not eliminate risk, and personal cloth gloves are not appropriate medical PPE. Question 63. In the emergency department, a blood splash risk is expected during specimen handling. Which PPE may be needed in addition to gloves? Option A. No additional protection because tubes are closed. Option B. A patient wristband. Option C, open-toed shoes for ventilation. Option D, eye or face protection according to exposure risk. The correct answer is option D. Eye or face protection according to exposure risk. Eye or face protection is used when splashes or sprays may expose mucous membranes. Open-toed shoes are unsafe, wristbands identify patients rather than protect staff, and closed tubes do not remove every splash risk. Question 64. For an older adult patient in Bay 3, after a needle stick injury, what is the immediate first aid response? Option A, wash the area with soap and water and report the exposure promptly. Option B, squeeze the wound aggressively for several minutes. Option C, apply a tourniquet above the injury and ignore reporting. Option D, keep working until the shift ends. The correct answer is option A. Wash the area with soap and water and report the exposure promptly. A sharps injury requires immediate cleaning, reporting, and follow-up according to exposure control policy. Delaying care, aggressively squeezing, or failing to report can increase health and documentation risks. Question 65. While preparing Lucas for a therapeutic drug level, what should happen to a safety needle after venipuncture? Option A, break the needle off by hand before disposal. Option B, activate the safety feature and discard the device in a sharps container. Option C, recap the needle with 2 hands. Option D, place it on the tray for later disposal. The correct answer is option B. Activate the safety feature and discard the device in a sharps container. Safety features and immediate sharps disposal reduce needle stick risk. Two-handed recapping, delayed disposal, and manually breaking needles are unsafe practices. Question 66. After reviewing the basic metabolic panel order, a sharps container is filled past the marked fill line. What should the phlebotomist do? Option A, continue using it until the lid will not close. Option B, move sharps into a plastic trash bag. Option C, use an approved container that is not overfilled and follow replacement procedure. Option D, push the contents down by hand. The correct answer is option C. Use an approved container that is not overfilled and follow replacement procedure. Overfilled sharps containers increase injury risk and should be replaced according to policy. Pushing sharps down, overusing the container, or transferring sharps to trash is unsafe. Question 67. During Chloe's early morning draw, a small blood spill occurs on the collection chair. Which action is appropriate? Option A, cover it with a clean drape and keep collecting. Option B, wipe it with a dry paper towel only. Option C, ask the next patient to avoid the spot. Option D, wear appropriate PPE and clean with an approved disinfectant according to policy. The correct answer is option D. Wear appropriate PPE and clean with an approved disinfectant according to policy.
The detail directly supports the claim because it gives a reason or example that matches the claim's main idea. Long words always have Latin roots, every answer choice has the same meaning, and students should skip difficult sentences are unrelated, too general, or inconsistent with the claim. Question 68. How are the two ideas related? The passage uses simple vocabulary. Its argument is still complex. And option A, sequence. Option B, definition. Option C, example. Option D, concession. The correct answer is option D, concession. The second sentence relates to the first through concession, so that relationship best describes the pair. Sequence, definition, and example describe different structures and do not match how the two statements work together. Question 69. Select the transition that best completes the sentence. The first sentence defines the term, blank. The second sentence explains the same concept in simpler words. Option A, similarly. Option B, however. Option C, therefore. Option D, for example. The correct answer is option A, similarly. The two ideas show comparison, so similarly creates the clearest logical connection, however signals a different relationship, therefore introduces a different type of link, and for example does not match the way the ideas connect. Question 70. The tone of the sentence, the writer respects the difficulty of the task while explaining how practice can make it manageable, is best described as what? Option A, supportive. Option B, jealous. Option C, threatening. Option D, dismissive. The correct answer is option A, supportive. The wording creates a supportive tone because it shows the writer's attitude toward the situation. Dismissive, jealous, and threatening do not match the emotional signal created by the sentence. Question 71. Based on the statement, the advisor offers optional reading workshops before registration week. Which inference is most reasonable? Option A, registration has been cancelled. Option B, some students may benefit from extra preparation before placement. Option C, the workshops replace the reading test. Option D, all students are required to attend workshops. The correct answer is option B. Some students may benefit from extra preparation before placement. The statement directly supports the idea that some students may benefit from extra preparation before placement. All students are required to attend workshops, registration has been cancelled, and the workshops replace the reading test go beyond the information given or contradict it. Question 72. Which detail best supports the claim transition words are important for comprehension? Option A, words such as however and therefore show contrast or result. Option B, comprehension depends only on spelling. Option C, transitions are never used in academic writing. Option D, every transition means the same thing. The correct answer is option A. Words such as however and therefore show contrast or result. The detail directly supports the claim because it gives a reason or example that matches the claim's main idea. Transitions are never used in academic writing, every transition means the same thing, and comprehension depends only on spelling are unrelated, too general, or inconsistent with the claim. Question 73. Which meaning best matches the word resilient when the context clue is able to recover after difficulty? Option A, able to recover after difficulty. Option B, strict. Option C, fragile. Option D, ordinary. The correct answer is option A, able to recover after difficulty. The context clue defines resilient as able to recover after difficulty, so that meaning fits the word. Fragile, ordinary, and strict point to different ideas and would change the meaning of the item. Question 74. Which meaning best matches the word impartial when the context clue is fair and unbiased? Option A, uncertain. Option B, fair and unbiased. Option C, prejudiced. Option D, angry. The correct answer is option B, fair and unbiased. The context clue defines impartial as fair and unbiased, so that meaning fits the word. Prejudiced, angry, and uncertain point to different ideas and would change the meaning of the item. Question 75. The tone of the sentence, the author jokes that the longest line on campus is always the one students join when they are already late, is best described as what? Option A, accusatory. Option B, formal. Option C, lighthearted. Option D, tragic. The correct answer is option C, lighthearted. The wording creates a lighthearted tone because it shows the writer's attitude toward the situation. Formal, tragic, and accusatory do not match the emotional signal created by the sentence. Question 76. Which meaning best matches the word ambiguous when the context clue is having more than one possible meaning? Option A, accurate. Option B, having more than one possible meaning. Option C, generous. Option D, obvious. The correct answer is option B, having more than one possible meaning. The context clue defines ambiguous as having more than one possible meaning, so that meaning fits the word. Obvious, accurate, and generous point to different ideas and would change the meaning of the item. Question 77. Select the transition that best completes the sentence. The library extended its evening hours. Blank, more students could study after work. Option A, for instance. Option B, similarly. Option C, in contrast. Option D, as a result. The correct answer is option D, as a result. The two ideas show cause and effect, so as a result creates the clearest logical connection. In contrast signals a different relationship, for instance introduces a different type of link, and similarly does not match the way the ideas connect. Question 78. In the sentence, Rena marked the transition word because it showed a contrast. What does it refer to? Option A, the transition word. Option B, the mark. Option C, Rena. Option D, a contrast. The correct answer is option A, the transition word. The pronoun points back to the transition word, which is the noun or idea that logically fits the action in the sentence. Rena, a contrast, and the mark do not complete the meaning of the pronoun as clearly or logically. Question 79. Identify the central idea of this statement. Comparing two ideas can reveal similarities, while contrasting them shows differences. Option A, comparison and contrast are different ways of relating ideas. Option B, comparison always shows cause. Option C, contrast means repeating an idea. Option D, similarities and differences are unrelated to reading. The correct answer is option A. Comparison and contrast are different ways of relating ideas. The sentence centers on the idea that comparison and contrast are different ways of relating ideas. Comparison always shows cause, contrast means repeating an idea, and similarities and differences are unrelated to reading, either focus on an unrelated point, distort the message, or overstate what the sentence says. Question 80. The tone of the sentence, the committee carefully reviewed each application before making a decision, is best described as what? Option A, methodical. Option B, resentful. Option C, mocking. Option D, panicked. The correct answer is option A, Methodical. The wording creates a methodical tone because it shows the writer's attitude toward the situation. Mocking, panicked, and resentful do not match the emotional signal created by the sentence. Question 81. How are the two ideas related? Context clues are surrounding words. They help readers determine the meaning of an unfamiliar term. Option A, sequence. Option B, definition. Option C, comparison. Option D, contrast. The correct answer is option B, definition. The second sentence relates to the first through definition, so that relationship best describes the pair. Contrast, sequence, and comparison describe different structures and do not match how the two statements work together. Question 82. How are the two ideas related? A topic sentence previews the paragraph's focus. A thesis statement previews an essay's main argument. Option A, cause and effect. Option B, problem and solution. Option C, comparison. Option D, contrast. The correct answer is option C, comparison. The second sentence relates to the first through comparison, so that relationship best describes the pair. Contrast, cause and effect, and problem and solution describe different structures and do not match how the two statements work together. Question 83. In the sentence, Jordan saved the confirmation email because it listed the appointment time. What does it refer to? Option A, the time. Option B, Jordan. Option C, the confirmation email. Option D, the appointment. The correct answer is option C, the confirmation email. The pronoun points back to the confirmation email, which is the noun or idea that logically fits the action in the sentence. Jordan, the appointment, and the time do not complete the meaning of the pronoun as clearly or logically. Question 84. Which assumption is most necessary for the statement, the college posts sample questions on its testing page? Option A, students may use sample questions to prepare. Option B, sample questions are hidden from students. Option C, the college discourages preparation. Option D, only instructors can read the page. The correct answer is option A. Students may use sample questions to prepare. The reasoning depends on the idea that students may use sample questions to prepare, because that link makes the statement sensible. Sample questions are hidden from students, the college discourages preparation, and only instructors can read the page either contradict the statement or it claims the statement does not require. Question 85. Why would a writer most likely include this statement? A checklist reminds students to read all answer choices before selecting one. Option A, to entertain readers with dialogue. Option B, to announce a weather forecast. Option C, to advise students on careful reading behavior. Option D, to summarize a novel's ending. The correct answer is option C, to advise students on careful reading behavior. The statement is designed to advise students on careful reading behavior, which matches its practical focus and wording. To entertain readers with dialogue, to announce a weather forecast, and to summarize a novel's ending describe purposes that are not supported by the content of the statement. Question 86. In the sentence, the advisor updated the schedule after it caused confusion. What does it refer to? Option A, the schedule. Option B, the update. Option C, the confusion. Option D, the advisor. The correct answer is option A, the schedule. The pronoun points back to the schedule, which is the noun or idea that logically fits the action in the sentence. The advisor, the update, and the confusion do not complete the meaning of the pronoun as clearly or logically. Question 87. Which detail best supports the claim strong readers distinguish facts from opinions? Option A, personal judgments are never used in writing. Option B, opinions are always longer than facts. Option C, facts cannot be checked. Option D, verifiable statements differ from personal judgments or beliefs. The correct answer is option D, verifiable statements differ from personal judgments or beliefs. The detail directly supports the claim because it gives a reason or example that matches the claim's main idea. Opinions are always longer than facts. Facts cannot be checked, and personal judgments are never used in writing are unrelated, too general, or inconsistent with the claim. Question 88. In the sentence, the report compared online practice and paper practice, and both had advantages. What does both refer to? Option A, the report. Option B, online practice and paper practice. Option C, advantages. Option D. Only online practice. The correct answer is option B. Online practice and paper practice. The pronoun points back to online practice and paper practice, which is the noun or idea that logically fits the action in the sentence. The report, advantages, and only online practice do not complete the meaning of the pronoun as clearly or logically. Question 89. How are the two ideas related? The testing center added more afternoon appointments. Students had shorter wait times for placement exams. Option A, cause and effect. Option B, comparison. Option C, contrast. Option D, definition. The correct answer is option A, cause and effect. The second sentence relates to the first through cause and effect, so that relationship best describes the pair. Contrast, definition, and comparison describe different structures and do not match how the two statements work together. Question 90. Which assumption is most necessary for the statement, the practice app reports skill categories after each session? Option A, skill categories are always identical. Option B, feedback is unrelated to studying. Option C, students can use feedback to identify weak areas. Option D, the app cannot track responses. The correct answer is option C. Students can use feedback to identify weak areas. The reasoning depends on the idea that students can use feedback to identify weak areas, because that link makes the statement sensible. Feedback is unrelated to studying, the app cannot track responses, and skill categories are always identical either contradict the statement or it claims the statement does not require. Question 91. Why would a writer most likely include this statement? A notice warns that late arrivals may need to reschedule. Option A. To summarize a research article. Option B. To praise students for arriving early. Option C. To caution students about a consequence. Option D. To describe a fictional setting. The correct answer is option C. To caution students about a consequence. The statement is designed to caution students about a consequence, which matches its practical focus and wording. To praise students for arriving early, to describe a fictional setting, and to summarize a research article describe purposes that are not supported by the content of the statement. Question 92. The tone of the sentence, the new reading lab offers flexible hours, helpful tutors, and free practice materials, is best described as what? Option A, doubtful. Option B, sarcastic. Option C, encouraging. Option D, hostile. The correct answer is option C, encouraging. The wording creates an encouraging tone because it shows the writer's attitude toward the situation. Hostile, doubtful, and sarcastic do not match the emotional signal created by the sentence. Question 93. Which assumption is most necessary for the statement, the advisor recommends vocabulary practice before the reading test? Option A, vocabulary practice replaces all reading skills. Option B, vocabulary knowledge can affect reading performance. Option C, the advisor teaches only math. Option D, students already know every word. The correct answer is option B. Vocabulary knowledge can affect reading performance. The reasoning depends on the idea that vocabulary knowledge can affect reading performance, because that link makes the statement sensible. Vocabulary practice replaces all reading skills, the advisor teaches only math, and students already know every word either contradict the statement or it claims the statement does not require. Question 94. How are the two ideas related? A writer argues that tutoring increases persistence. She cites improved attendance after tutoring expanded. Option A, definition. Option B, evidence and claim. Option C, sequence. Option D, contrast. The correct answer is option B, evidence and claim. The second sentence relates to the first through evidence and claim, so that relationship best describes the pair. Sequence, contrast, and definition describe different structures and do not match how the two statements work together. Question 95. Identify the central idea of this statement. Transition words such as however, therefore, and similarly reveal how ideas fit together. Option A, readers should ignore connecting words. Option B, signal words help readers identify relationships between ideas. Option C, transition words are mainly spelling clues. Option D, every sentence uses the same transition. The correct answer is option B. Signal words help readers identify relationships between ideas. The sentence centers on the idea that signal words help readers identify relationships between ideas. Transition words are mainly spelling clues. Every sentence uses the same transition, and readers should ignore connecting words, either focus on an unrelated point, distort the message, or overstate what the sentence says. Question 96. Why would a writer most likely include this statement? A sentence describes how the meaning of a word changes when the surrounding words change. Option A. To ask for private information. Option B. To explain context-dependent meaning. Option C. To celebrate a holiday. Option D. To compare two sports. The correct answer is option B. To explain context-dependent meaning. The statement is designed to explain context-dependent meaning, which matches its practical focus and wording. To celebrate a holiday, to compare two sports, and to ask for private information describe purposes that are not supported by the content of the statement. Question 97. Which meaning best matches the word inevitable when the context clue is certain to happen? Option A, certain to happen. Option B, temporary. Option C, unlikely. Option D, avoidable. The correct answer is option A, certain to happen. The context clue defines inevitable as certain to happen, so that meaning fits the word. Avoidable, temporary, and unlikely point to different ideas and would change the meaning of the item. Question 98. The tone of the sentence, unfortunately, the old policy created unnecessary obstacles for many students, is best described as what? Option A, celebratory. Option B, critical. Option C, neutral. Option D, playful. The correct answer is option B, critical. The wording creates a critical tone because it shows the writer's attitude toward the situation. Celebratory, neutral, and playful do not match the emotional signal created by the sentence. Question 99. Identify the central idea of this statement. Answer choices that are too extreme often fail because they add ideas not proven by the text. Option A, unsupported details improve accuracy. Option B, the text never limits an answer. Option C, overly broad choices may be unsupported. Option D, extreme choices are always correct. The correct answer is option C, overly broad choices may be unsupported. The sentence centers on the idea that overly broad choices may be unsupported. Extreme choices are always correct, unsupported details improve accuracy, and the text never limits an answer, either focus on an unrelated point, distort the message, or overstate what the sentence says. Question 100. Select the transition that best completes the sentence. Several strategies improve comprehension. Blank, annotating, previewing headings, and rereading difficult sentences are useful. Option A, for example. Option B, instead. Option C, therefore. Option D, however. The correct answer is option A, for example. The two ideas show example, so for example creates the clearest logical connection, therefore signals a different relationship, however introduces a different type of link, and instead does not match the way the ideas connect.